Hey again, friends from WOMedic. We are here in Cancun again, of course, and we're at the Olympia Clinic. We're going to talk today about sports medicine with Dr. Wahid. He's going to tell us a little bit about what that is and what we can use it for with our friends from WOMedic. Let's go meet him. Doctor?
Hello, Chris.
Nice to meet you, Wahid.
Nice to meet you.
Can you tell us a little bit about sports medicine, regenerative medicine?
So I'm a sports medicine physician, but I specialize in regenerative procedures for joints, muscles, tendons that are injured or they are torn or they have some wear out.
Can you tell us a little bit more, Dr. Wahid, about sports medicine in general, how it may differ from the type of patient that other doctors might be seeing, and if it's an invasive type of medicine or if it's a non-invasive type of medicine?
So sports medicine, it's the part of the medical profession that actually follows an athlete through the nutrition, their injuries, and all the sports physiology to boost their performance. But in my case, I specialize in non-invasive, actually they are ultra minimal invasive regenerative procedures for, like I told you, joints, like the shoulder, the spine, knees, and practically any joint.
Doctor, can you tell us a little bit more about the other kinds of services that you're offering here at the clinic?
Sure, so we mainly have regenerative procedures like stem cells procedures for joint rejuvenation, PRP also for joints and muscles and ligaments, prolotherapy that is kind of the same each patient. I can, maybe they need one or the other. We have sports and clinical nutrition. We have a rehab physiotherapy area, and we have neuro rehabilitation for patients that have like a stroke or some neurological issue. And we also have the means to check the fit and posture that is the base for any other kind of diagnosis and treatments. If we don't treat our main base and stability, everything else can fail.
Doctor, can you tell us a little bit more about how you determine whether a patient is a candidate for a procedure in your clinic or not?
So first we're going to have a consultation. So I have to see the patient here if the patient is in the area. And we also have an online consultation for persons that don't live in Cancun. So that I can tell them, we are going to discuss for maybe an hour their case, and then we're going to see if it's possible for them to come because they're like free candidates for treatment.
Doctor, we're seeing some interesting images on the screen right now. Can you explain to me what's happening?
Okay, so after we do a procedure to take bone marrow out of a patient to get stem cells, you're watching in the screen all the procedure to clean that bone marrow so that we can have our final product. That's the one that we're going to inject, the one that is full with the growth factors.
Okay, doctor, we're seeing a bit of a different image on the screen right now. Can you explain to us what's happening here?
Okay, well, this is a procedure that after we obtain our product, this is how we inject the procedure. You're watching prolotherapy in action. So I'm injecting some facet joints because this patient has degenerative disease of the bone structure of the spine. So this is prolotherapy, but we also can do PRP or stem cells depending on the patient and depending also on the diagnosis.
Doctor, I know you mentioned in part what you guys do here, but can you give us a more complete list of all the services you're offering here at the clinic?
So we have sports medicine and regenerative sports medicine. We also have neuro rehabilitation for patients with strokes or brain kind of injuries. We have nutrition, sports and clinical nutrition. We have physiotherapy, like and a little gym to make people that are with pain and bad posture to gain again strength and mobility. And we also have the way to check like the foot and posture.
It seems like you're saying that posture is a really important part of one's sort of foundational health, at least physiologically speaking. Can you speak a little bit to that, doctor?
Sure. If your step is not right, if you have the arch of the foot is dropping, or your posture, you're sideways, any kind of treatment of these new technological procedures may fail if the foundation it's not correct. So that's the point of doing this full checkup before putting somebody to a specific treatment.
We've had a really interesting interview with Dr. Wahid. Thank you so much.
Thank you, Chris.
Nice to meet you.
Nice to meet you too.
Friends of WOMedic, we're back in Cancun again. Like I said before, we met another fantastic doctor at a fantastic clinic. We're offering better and better services all the time. This is medicine we've never even talked about before, sports medicine, but don't forget, we have another list of all sorts of things that we're still doing. Every time you ask us to add something more interesting, we find something more interesting. Thank you guys so much. Visit us at womedic.com. We will see you next time from Cancun. Take care.
You can contact these doctors through us using your WOMedic medical discount card available on our website at womedic.com. Log in today and take advantage of all the benefits and discounts that we can offer your family. Thank you for listening.